Doc Talk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson. I'm joined by friend and colleague, Dr. Bob Larson. Welcome to the show.
Good to be here, Dan.
And Dr. Larson is the Coleman Chair, and he is a professor in the Department of Clinical Sciences here at the College of Veterinary Medicine at Kansas State University. And Bob, you've done a lot of things with beef herds throughout your life, and whether it's in private practice or extension or through your research, vaccines tend to continuously come up in conversation.
That's exactly right. We often think of veterinarians as being involved in treating sick animals, diagnosing disease, and those kinds of things, and that's an important role for veterinarians. But another very important role is to prevent disease.
You bet.
And there's several things that fall into that category of preventing disease. We talk about biosecurity, biocontainment to prevent the introduction and spread of disease, and vaccinations play a key role in that biosecurity or minimizing the effects of disease. So when we think of vaccinations, there's really several things to think about. Yep. The area we live in, what are the disease risks that our cattle are really facing, and then which diseases do we have vaccines available to use? Because there's a lot of diseases that there aren't effective vaccines available. So all of that type of thinking involves a close relationship between the veterinarian and producer to really think through what their goals are and what's kind of a situation that they are placed in. You know, some of the things to think about is just the disease risk, the chance to be exposed to viruses or bacteria that can cause disease. That's going to be different depending on if the herd is open, they buy a lot of replacements, they buy stocker cattle and graze those next to the pregnant cow herd, or a herd that's very, very closed. Fairly isolated, not a lot of neighbors, maybe just cropland as neighboring property. In that type of a situation, the disease risk is going to be much less.
Right.
And those are the things we have to think about as you plan a vaccination protocol.
We had a show when we discussed with equine practitioners about the difference between, core vaccines and risk-based vaccine decisions. And what you're saying is there are those core vaccines that we're going to use in our cow herd because it's indigenous around the country. But then there's the risk-based based on production, and working with that veterinarian is hugely important.
That's exactly right. So I think that's a good way to think about it. There's certain diseases that we're probably going to use or vaccines in almost every herd. An example might be our Clostridial or blackleg type vaccines. That's a germ that lives in the soil. It's present really throughout the United States and anywhere you'd go. So we'd take a core vaccine like that and then adjust what a particular herd needs based on what their risk level is.
Great introduction, great start. Thanks for being here. Thank you for being here. And when we come back from the break, we're going to continue our discussion with Dr. Bob Larson on vaccination protocols for the cow herd. Thanks for joining us.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine. I'm joined by Dr. Bob Larson, who is a veterinarian in the College of Veterinary Medicine, but he is the Coleman Chair and Professor of Clinical Sciences. And we're talking about vaccines. Gave a great introduction as to the vaccines. Now, one of the questions I got in practice, and what makes a successful vaccination?
Well, that is a good question, because it's easy to start wanting our vaccines to do more than they can.
Right.
We would like it if I could use a bottle to solve all problems and prevent all health problems. Yeah. We know that as humans, human health,
the silver bullet,
and animal health, it doesn't work that way.
Right.
Vaccines have been a great tool. I mean, you look throughout history, starting with some of the early livestock and human vaccines, what a difference they've made in health and longevity. So they're a great tool, but they're only that. They're only a tool. so that for a vaccine program to really work, I have to administer it into cattle that have the ability to build a good, strong immune response to that vaccine and then be able to fight off disease. And then I have to do other things, primarily sanitation and maybe some the housing of animals, where we put them and who we put them against, to decrease the level of exposure. So if I can increase the immunity and decrease the level of exposure, I can greatly improve the health of a population of cattle. So when I say the ideal candidate to vaccinate, first of all, they need to be well fed. The nutrition has to be very good. When we ask an animal to build an immune response, that uses proteins to build those immune bodies to fight disease. The animal is not going to respond well if they're short of energy, if they're short of protein, or some of our key minerals and vitamins. So I need the diet to be excellent. I need the diet to be excellent so that the animal can respond to the vaccine. I need my animals to be relatively free of stress, in that my housing has to be good. I don't like to vaccinate when the weather is really inclement. It's really a problem because they're not going to respond as well to that vaccine. And so I need my animals to be in a good plane of nutrition, the housing and the environment to be good so that they're not under a lot of stress. And then I want to make sure that I'm timing my vaccines ahead of my disease challenges, or when I'm concerned about disease. Because when we talk about vaccination and the immune response, that takes some time. That doesn't happen immediately after the injection. So I want to, again, kind of knowing the herd, knowing when exposures might occur, try to get my vaccines into those animals at a time, several weeks ahead of when I'm most concerned about problems occurring. If I can do all of those things, so I've got a good environment, got a good diet, and I add effective vaccines at the right timing, then I can really impact health in a positive way.
And animal handling, of course, as well, decreases stress if we do that in a low-stress manner.
Absolutely. Everything we can do to make everything about the herd running well.
Great information. Start with that healthy animal when you vaccinate. We'll be back after the break to discuss more about vaccinations in the cow herd with Dr. Bob Larson. Thanks for joining us.
Doc Talk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson, joined by Dr. Bob Larson. We're both from the College of Veterinary Medicine here at Kansas State University, and Dr. Larson is the Coleman Chair of Production Medicine and a Professor of Clinical Sciences, and we're discussing vaccination programs in cow herds. And so let's get into start to tiptoe into the weeds here and get down to the which calves and cows and bulls and all that. Where do you want to start?
Well, let's think about kind of the three groups of animals that might be on a ranch that we're going to talk about vaccinating. Okay. I'm going to start with kind of my young animals, so up to the time that they are weaned, 6 months of age, something like that. My adult cows, my adult females, and my adult males. So I'm going to kind of divide it in those ways. When I'm looking at young calves, so you're talking about calves from the time they're born until the time they're weaned, there's a couple of diseases that I'm particularly concerned about. One is, and I mentioned it earlier, blackleg or the clostridial diseases. Those are diseases where the germ that causes that is actually in the soil. It's commonly present in the soil. So a vaccine program to raise the immunity and to help protect those calves is important. We try to get that vaccine into those calves relatively early, far ahead of weaning if possible. So 2 months of age, 3 months of age, something like that. If we can get that into the calves at that time, that really helps. Now we're going to booster that blackleg or clostridial vaccine later in life as well, but we want to start that fairly young. Yep. Then as those calves get closer to weaning age, I start to want to prepare those calves for time after it's away from mama. Yep. So the biggest disease we're concerned in that stage of life is respiratory disease or pneumonia. And so at some point while that calf is still on the cow or right up to the time of weaning, I'm going to try to get some doses of viral respiratory vaccine into those calves and possibly even bacterial vaccines. trying to prevent the germs that cause pneumonia in those calves right post-weaning. So if I can do that in those calves, I can have a calf that's a lot more likely to be strong and healthy and take off right after weaning.
Well, it goes back to getting that vaccine into the animal prior to exposure.
Exactly. If I can do that before the really high risk time occurs, then I should have good success.
How about those adult females?
Adult females, I'm not as concerned about respiratory disease.
Right.
There are some areas of the country where I'm still concerned about some of the blackleg type diseases, so I'll probably include that in most cow herd vaccines. But what I'm concerned about in cows is some of the diseases that will cause abortion. We have a number of diseases that cause abortion in cows, so I get her pregnant, but then she doesn't carry it all the way through pregnancy. So in order to do that, I'm going to use, and again, some of the same viruses that cause respiratory disease also cause abortion. Right. So my best timing, if I can accomplish it, is to actually get vaccines into the cows ahead of the breeding season. Right. So between the time she calves and the time she calves, and she breeds, I'll try to get a vaccine into her at that time. Some vaccines are labeled to be given during pregnancy, and I can make that work as well, but I'm really focusing on those diseases that cause abortion.
Perfect. When we're going to take a break. When we come back from the break, we'll wrap up with the adult bulls, and then we'll go into some handling of vaccine.
Yeah, that's an important area too.
Really glad you joined us today.
Thanks.
Thanks for joining us, and we'll see you after the break discussing vaccines in the cow herds with Dr. Bob Larson.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Bob Larson, who's the Coleman Chair of Production Medicine and a Professor of Clinical Sciences at Kansas State University's College of Veterinary Medicine, and we're talking about vaccinations. We left off with the cows.
Yes.
And we're going to talk about the bulls. And when we talk about the repro antigens, what are the main things you're concerned about?
The main diseases that we have good effective vaccines for are two viruses that cause abortions, IBR and BVD, as well as a couple of bacteria, lepto and vibrio. Those are the terms we typically use.
Right.
And so most cows are going to have an IBR, BVD, lepto and vibrio vaccine, both as a heifer and then annually as a cow.
In the heifers, it's important to booster?
Very important. You know, it's kind of like sending our kids to kindergarten. Multiple vaccines when they're young to really set them up for a lifetime good immunity.
And then it's an annual.
And then it's an annual booster after that.
What about the bulls?
The good news about bulls is what I think the easiest way to think about it is to vaccinate bulls with the same vaccines I'm using on my cows that are the same age. So when I've got young yearling bulls, I vaccinate them like young yearling replacement heifers. So they're going to get multiple doses of my IBR, BVD, lepto, vibrio, headed into their first breeding season, and then annual boosters just like the cows then once they're an adult.
Same antigens and pretty much
Pretty much exactly the same.
Well, I know that the other important factor in a good vaccination program is proper vaccination technique and storage, and I know you want to spend a little time talking about BQA principles.
Exactly. You know, if you spend the money to buy a product and you develop the plan when you know when you're going to vaccinate, it would be a shame to then have the vaccine not work very well.
Right.
And so things like most of our vaccines need to be refrigerated, so maintaining them at a proper temperature. Don't let them get frozen. Don't let them get hot. Most of our vaccines are very sensitive to sunlight, so keep them in the shade. So while you're working with it, keep it in a cooler or someplace like that. It doesn't only keep it cool, but it keeps it out of the sunlight. The syringes we use need to be well maintained, and you might have to buy a new one every once in a while just to have good quality equipment. The needles, we use disposable needles, and the current recommendation depends on the herd, but generally no more than 10 head per needle, and then switch needles. Some herds we switch it even more frequently than that. Right. So I want, to take care of my vaccines, the temperature control, keep them out of sunlight, use good quality syringes, and change my needles frequently. Then the other thing is, all of those vaccines come with an instruction sheet, and it's easy to not remember to read that, but it is important to read that, and it'll give you some instructions on where to vaccinate. If the vaccine is labeled to give under the skin or sub-Q, under the skin and the neck. If it's labeled to give in the muscle, give it in the muscle, in the neck, never in the back leg. but follow those label instructions.
Great. Great show today. Thank you so much for taking time out of your busy schedule and spending it with us here on the show.
It's good to be here.
Great. Thank you for watching Doc Talk. And remember, if you want to learn more about what Dr. Larson and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember to always work with your local practitioner and veterinarian on these decisions. Thanks for watching Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine. I'll see you down the road.